Hey friends, welcome back to the channel. My name is Majid and I'm a 4th year MBBS student from India. In this video, we'll be talking about how you can become a practicing doctor in United States of America. So the pathway to become a practicing doctor in United States is called USMLE or United States Medical Licensing Exam. Anybody who wants to become a doctor in US has to do residency, and the only way to get into a residency spot is through USMLE. There's a lot of confusion among medical graduates and medical students around the world that there might be some other pathway that can guarantee a spot as a practicing doctor in United States, but it's not true. The only pathway is USMLE. So any advertisement that you see claiming that they help to get you a license in US to practice medicine is just a scam. Now let us talk about the advantages of USMLE or becoming a doctor in US. So the first one is, so before moving ahead into the video, I want to just clarify the process in general. So this pathway has 3 exams: USMLE Step 1 exam, Step 2 CK, and Occupational English Test, which is a replacement of Step 2 CS exam, and USMLE Step 3 exam. And then there is something called ECFMG registration, and then there is NRMP match, interviews, rank order list, and finally the match date. And after all this process, you get a spot in residency. So let us see the advantages of becoming a doctor in America. So the first one is that the degree is recognized all around the world, which means if you are a doctor from America, if you are trained in America, in United States, then your degree or your license is valid all around the world. Second advantage is you don't need to take any licensing exam for any other country of the world. Suppose you want to move somewhere in Asia or some other countries of Europe, so your degree will be recognized and your license will be recognized all around the world, so you don't need to take any additional licensing exam after USMLE. The third and the best advantage is you'll get a cutting-edge healthcare facility and the state-of-the-art institutions with latest technologies in use. And the next one is electronic medical record for everything. So there is no manual work, no paperwork, everything from the prescription of the patient to the drugs given while the patient is in the ward. You will have everything done on EMR, which is electronic medical record. So there is no additional bulk paperwork and it saves a lot of time. There is no overwork burden and a very good work-life balance. And then you get paid vacations every year for a month or so, and there is a lot of time for you to actually do other stuffs and follow your passion in your life, or just take a leisure time out and do whatever that pleases you. And the last and most important of all is the job in United States pays very high and probably the highest pay of doctor in the world. So if you are a practicing doctor in United States of America, you're probably earning the highest salary in your field among all the doctors from the world. So without taking much of your time, let us start with the first step, which is USMLE Step 1 exam. The new change to this exam is now this exam has become a pass-fail exam after 2021. In order to sit for Step 1 exam, you need to book it in advance, and the booking must be done somewhere around 6 months in advance. And even before booking for Step 1 exam, you need to fill a form on the ECFMG website. ECFMG stands for Educational Council for Foreign Medical Graduates, and you need to fill the form number 186. This exam covers the preclinical subjects or the subjects of your first and second year of med school. And this exam has 280 multiple choice questions over 8 hours. So the time frame of this exam is of 8 hours, which is divided into 2 parts. The first part is of 7 hours, and this 7 hours consists of 7 blocks which are of 1 hour each, and 1 hour is separate for the break time, which has 15 minutes orientation time and 45 minutes of break time. What you can do, what most of the people don't know, is you can convert this 15 minutes of orientation time into your break time and add up 15 minutes into your break time, and this could bring about 1 hour of break time by visiting NBME website prior to your exam and watching the orientation video in advance. Now the prep time for this exam is 5 to 7 months, which is very easy. And the resources for step 1 are Boards and Beyonds. It is a video series that covers most of the important conceptual portion of your study material. Then there is UWorld, which is the main question bank you need to follow. UWorld is actually very beneficial as it has over 3600 plus multiple choice questions, and you can set the timer for yourself and take your self assessments and keep solving questions over and over again, which improves your analytical skills and also brings in more depth in your preparation. Next one is First Aid and USMLE RX. First Aid is the Bible of USMLE Step 1 preparation, and this book right here has it all in. You just need to go through all the pages of this and keep revising it for multiple times. Like maybe you need to give 3 to 4 revisions before sitting for the exam. The next thing is Pathoma. Pathoma is another important resource that covers everything about pathology, and Pathoma has everything in pathology covered for you. And then the last one but not the least is Sketchy. Sketchy is a medical app which is very, very helpful, especially for first and second year medical students or the ones who are even preparing for USMLE. Sketchy covers subjects like microbiology and pharmacology. It has a very picturesque representation of the subject and the concept. Picture elaborates the concept, and then if you visualize that picture into your brain, you will never forget that, and that is the best form of memory. The visual memory is the best form of memory. If you want to know more about the learning resources for USMLE Step 1 exam or Step 2 exam, you can subscribe to my YouTube channel, and I'm very soon going to make an elaborate video to cover all the resources and how to actually study for these exams. Now let us move to the second exam or the second milestone of the USMLE journey, which is USMLE Step 2 CK exam. The CK stands for clinical knowledge. This exam needs a preparation time of 4 to 5 months if you have a very strong understanding of preclinical subjects, or if you have given your USMLE Step 1 exam with flying colors. This exam is 9 hours long exam, so it is insanely long exam. And now again, the exam is separated into 2 time frames, like 8 hours is separate and 1 hour is separate for your break time, and 8 hours consist of questions. So 8 hours is divided into 8 blocks which are of 1 hour each, and the 1 hour of break time is further again divided in the similar way as in USMLE Step 1, which is 15 minutes of orientation time and 45 minutes of actual break time. And then you can convert this orientation time into your actual break time, as I said, by visiting NBME website and watching the orientation video. This is a scored exam, unlike USMLE Step 1 which was pass-fail, so you will get a 3-digit score against your performance. And USMLE Step 2 CK is by far the most important exam in your USMLE pathway, because this is the only scored criteria. I mean, the program directors and the head of the departments need a score to actually judge and categorize the students based on something, and Step 2 CK brings a scored result, so Step 2 CK becomes by far the most important exam in this journey. The resources summary for this exam is UWorld, which is the main question bank. Again, you need to take another subscription for Step 2 CK preparation. And then there is Boards and Beyonds, which is an optional, but it is really good if your basics are not very clear. You can go to subscribe them, and it is a video series. Then there is this amazing resource called Divine Intervention Podcast, which is free and you can use it. I'll provide its link down in the description. By far the most important resource for Step 2 CK preparation is Amboss Library, which is the main book that you need to study. The library that covers extensively everything, and it is updated every now and then, so you need not look anywhere else to prepare. Amboss Library is self-reliant and self-sufficient to form the basic concept and your core in Step 2 CK preparation. And I would say Amboss Library is much more better than First Aid for Step 2 CK. First Aid is Bible for Step 1 preparation, but First Aid Step 2 CK book is not that great in the sense that it does not have very high yield topics as Amboss Library offers. And for Amboss Library there is a free trial available, so you can always go and check it out for yourself before deciding which resource to choose. So the next milestone in USMLE pathway preparation is OET exam or Occupational English Test. This is a replacement of Step 2 CS exam due to COVID. Because of the pandemic, it was not possible for the applicants to fly to the US and give the Step 2 CS exam in person. So OET has replaced it now, and the preparation time for this exam is 1 to 2 weeks max. It is a very easy exam, and even if you fail in your first attempt, nobody cares, but generally nobody fails in this exam. It tests for your English speaking skills in the medical setting, as in how you communicate with your patients and how you communicate with your fellow doctors. The resources for this exam is E2 OET free course, which is available online. I'll link it down in the description, and the official OET sample papers, which are available everywhere online. So you can just go ahead before your preparation, download the sample papers and do it. Now the next and the big step towards your USMLE pathway is ECFMG certification. ECFMG stands for Educational Council for Foreign Medical Graduates. So for ECFMG certification, you need to have your USMLE Step 1 and Step 2 results. You need to have your primary MBBS degree with you, and you need to upload your OET results and a letter of good standing from the dean of your medical school. ECFMG certification means after ECFMG certification, you and any other American medical graduates stay level. What I would like to add over here is ECFMG is not required for NRMP match, but it is highly recommended. Like, it's not a required criteria for you to have an ECFMG certification before you apply for a match, but if you do have ECFMG certification, it is of great advantage, because any program director wants to choose somebody who has a clear understanding of you. So if like 10 IMGs apply and you are the only one who does not have an ECFMG certification while matching, then obviously the program directors might look at you at the last, because the rest 9 of them do have ECFMG certification. Now once you're done with all the exams and ECFMG certification, it's now time for you to match. So what is match? Match is a provision where programs and applicants participate like they're in a date. Like in a dating app, you look for your partner and you specify what all you have to offer. You also know back of your mind that what all are the things that you want to see in your partner. So you create your own list and then they create their own list. So the same way in match, the programs create their own list and then you create your own list and then you apply to those programs. But before even applying to the match, you need to fill a form called ERAS application. ERAS application in itself is a very extensive process, and I will make a video on it sometime later. So let me just brief you on ERAS application. So ERAS application has to be submitted 29th of September of every year is the deadline for filling the ERAS application and submitting it. The things that are uploaded in the ERAS application are professional experience, volunteer experience, research experience, letter of recommendations, personal statement, MSPE, which stands for Medical School Performance Evaluation, and medical school transcripts. Also, you can give the proof of your extensive research if you have. Let us see each of these entities in detail. The professional experience can be of USA or your home country. If it is a USA, it is called USCE or United States Clinical Experience. So USCE or United States Clinical Experience is achieved by an applicant after their step 1 exam, most preferably, and then they fly to the US and see how the healthcare system works there, how electronic medical records work, and how everything works around in the hospital. There are 2 types of USCs. One is hands off and another is hands on. In hands off, you're not allowed to touch the patient or interact with the patient or do anything else apart from just discussing the course of treatment with your doctor under whom you will be shadowing. So it is also called an observership, wherein you are just observing what is being done to the patient or what is being done in the hospital, and you have no say in any of the course of the treatment. But on the other hand, there is hands-on experience in which you have permission to touch the patient, to take the physical examination, to do clinical assessments, and even take extensive history of the patient and then discuss the course of treatment with your consultant. So it is a better of the two. The hands-on experience is much better and much more taken into consideration than the observership, because it brings in a lot of LORs or letter of recommendations, and because the consultant knows how you feel and what have you done over there, so it can get you so many letter of recommendations, unlike observerships which do not offer much LORs. This was about the United States clinical experience, and then you can have the professional experience in your home country, like if you have done any PG courses, or if you have done any internships or externship, or if you have done any job after your graduation from med school in your home country, then you can just show its record. The next point is volunteer experience. Volunteer experience is any experience for which you are not paid. You are doing it out of your good heart, like joining any membership clubs like Lions Club or Red Cross, and then visiting any AIDS camp or polio camps across the country. And you can show your research experience if you have participated and published any research papers, or even just participated in any team who was doing research in your med school. LORs or letters of recommendation. So there are two types of LORs. One is US LORs and another is home country LORs. US LORs are taken by clinical rotations in United States. If you take USCE and rotate around in hospitals in United States of America, and then at the end of the USCE program, you can talk to your program directors and request them to provide you with an LOR, and if they think you are capable enough, they will provide you with an LOR. The other type of LOR is the home country LOR, which is the LOR from your med school, from the teachers of your med school, any of the professors who have taught you in the med school, and if they give the LOR, it is considered under home country LOR. So you can maximum upload 4 LORs per program. So it is better if you have all 4 LORs from United States rather than your home country. Then there is MSP or medical school performance evaluation. MSP records all your performance through your 5 years of journey in med school, and then you have to upload the medical school transcript under ERAS application. So medical school transcript has your score from the med school in each subjects like anatomy, physiology, right till the medicine. So it is basically your scorecard in the med school. Now I need to add one note over here, is that MSP and medical school transcripts are not of much consideration for an IMG. They are of much value to AMGs or American medical graduates, because MSP and medical school transcripts cannot be translated equally and appropriately into US clinical system, as the marking criteria and the marking system around the United States is different and completely different from rest of the world. Now if you want to know more about the extensive research which is required in competitive specialties like surgery, neurosurgery, dermatology, radiology and orthopedics, then you can watch this video by Malik Syed, who has done 100 plus publications and more than 1000 citations in clinical research. So I'll link down this video as well in the description to check it out. Now after you fill in your ERAS application and submit your application for an NRMP match, deadline for the submission of this application is 29th of September every year, and then after that you have a season of interview. Now let us discuss how interviews are for USMLE pathway. Interview season starts right after the September, so it is a 4-month period including October, November, December and the January of the following year. The people who will interview you might be program directors, chief residents and associate professors, or it could be anybody else from the program. Interviews previously used to be in person, so you had to fly to the program, fly to that hospital and visit the program directors and give the interview in person. But now due to COVID and after COVID, the interview has been shifted to a virtual format. It is a 4 to 6 hour long interview. It's not just an interview, it's an extensive interview of 6 hours. So let us see what are you assessed for in these interviews. Most importantly, they see how you are as a person and how are your English communication skills. They'll ask you answers to ethical questions and behavioral questions, like they'll throw at you some ethical situation, real life ethical situation, wherein they'll give you 10 minutes to think and then you need to come up with an answer and satisfy them that how are you going to tackle this situation. They will not be assessing you on your medical knowledge, so just rest assured. It is going to be English communication skill and ethical and behavioral questions. And more importantly, it is an interactive session wherein they want to know you as a person, know your personalities, your passion, your hobbies and how you are as a person before they are sure that they want to take you as an applicant as a PGY1 in their program. The more competitive your application is for NRMP match, the more number of interviews you will get eventually, and the more number of interviews that you attend, the more are your chances to finally match into a residency program. At the end of each interview, you need to send a thank you letter by post or by email to the program directors, the associate professors, the chief residents. So just do not forget it. If you thank them, they get very pleased, and then they really start considering you as a good person, and then they'll take you into their programs. Let us discuss ROL or rank order list. So after the interview season, a rank order list is created by the programs as well as the applicants. This is done after the interview season. Both applicants and programs create their own separate ROL or rank order list. So let's suppose after you filed your application for a match, you got maybe 10 calls for interview. So you know how or which interview was your best and which program are you looking for the most. So you can rank your programs based on the interviews and based on your preference and based on your desire, what you want. So you need to rank them from 1 to 10, 1 being your highest choice. And then the programs also might have interviewed 50 to 60 applicants, or maybe even 100, let's say 50 for now. So they are also going to rank the preference of their applicants who they want to join into their program. Both of the parties, the applicant and the programs, create their own rank order list. And then let's suppose you chose John Hopkins at first position, and then John Hopkins chose you at the second position. So if you chose John Hopkins at the first position, your ROL will be given preference over the program's ROL, and you will be matched into John Hopkins residency program. So after ROL or rank order list, here comes the match date, which is most eagerly awaiting period for all of the applicants around the world. So the match date is mostly on the second Monday of the year, and on this day you will know whether you have matched or not. And 5 days after this, on the second Friday of the March, you will be getting to know where have you actually matched, if you matched. And there's a 5-day gap between you knowing whether you matched or not and you knowing where have you matched, if you even did. You might ask me, Majid, why is there a 5-day gap between the two? So the answer is there is something called SOAP for the people who do not match on a match day, and then they can apply through SOAP, fill in the spots that went vacant during the match day. So there might be like, let's say 100 vacant spots. So the people who have not matched on the second Monday of the March, they have a chance to apply through SOAP for the vacant spots and then get their residency program spot. That's the reason why there is a 5-day delay between the two dates. Now the next step in USMLE journey is USMLE Step 3 exam. This exam is not required for you to match. It can be taken after you match into a program. It is mostly taken by PGY1 and PGY2. But if you are an IMG and you want to make your application very competitive, then you can take it before your match, and then you will have more chances of matching. So this is a 16-hour long exam, and it is split into 2 days. The day 1 is called the Foundation of Independent Practice. It is a 7-hour exam which is divided into 6 hours and 1 hour break. So 6 hours is the proper exam time, and 1 hour break, which is further divided into 15 minutes orientation time and 45 minutes of your break time. And then you can convert this 15 minutes of orientation time into your complete 1 hour break time. And then the 6 hours of actual exam is divided into 6 blocks of MCQ question. One block is of 1 hour, and there are 232 questions, which means 38 to 39 questions per block. So the second day of exam, it is not mandatory for you to take the exam on the second day itself after your day 1. You can take it within a week, but the day 2 exam has to be taken within a week, and it is called Advanced Clinical Medicine plus CCS cases. It is a 9 hours long exam which is divided into 2 parts, 6 hours and 3 hours. So the 6 hours is divided into 6 blocks. Each block is 45 minutes and 180 questions are there in total, which equates to 30 MCQs per block. The next part, which is of 3 hours, has 13 CCS cases which are of 10 to 20 minutes each. The CCS cases are actually a computer programmed virtual clinical scenario wherein you will be prescribing the patient the drug, you will be deciding the course of treatment, you will be opting for any surgical intervention. It is similar to Step 2 CS, which was before. So if you have taken Step 2 CS, you will be very familiar with this exam. This exam is not required before the match, but you have to take USMLE Step 3 exam once you are in your residency program, because you cannot pass PG by 2 unless you clear this exam. So let us see what are my final thoughts on this exam. USMLE pathway is a very long pathway if you see it from a bird's eye view, but if you take one step at a time, it is very easy and anybody can do it. I mean, it has more chance of you matching into a residency program than that of your home country like India. But let me tell you, USMLE pathway does not guarantee that you will get a residency spot even if you have high score in Step 2 CK and you have best USCE experience or United States clinical experiences. I know people who have had very high scores and best USC but still they failed to match. But I also know people who didn't have very high score and they just didn't have very good USC, but they decorated their CV in a very good manner with their clinical experiences and their clinical research, and they got a spot in the match and they got a spot in the residency program eventually. The people who travel the whole journey of USMLE right from Step 1 till the Step 3 and have very high score in Step 2 CK and they have best USC and they still do not match, they can obviously do 1 or 2 years of research electives and they can get a couple of LORs or letters of recommendations and they can do CV building, and the next year they can apply again for match and get themselves matched into a residency program. Now coming to the last and final aspect of USMLE journey is the total cost that it takes to complete this journey. So it might take anywhere around 20,000 to 25,000 US dollars, which is around 20 to 25 lakh Indian rupees. But if you have that money and you have the resources to do it and you have the support, then I would say it is risk worth taking. It's a life-changing experience and you can live your American dream if you do have one. And if you want to watch a detailed video on cost and what is the breakdown of this 20 to 25,000 US dollars, then I'll make a separate video. So make sure you subscribe to the channel, hit that bell icon there so that you do not miss any update. And at the end, I would thank you a lot for watching this video, and please do share with anybody who is willing to take the USMLE pathway, any of your friends in med school or your relatives or cousins. Thank you.